Hi, welcome to my page. Click here to subscribe to our YouTube channel.
Roy Richdrew is going to share with you today, of course, the disability rep, your disability rep. And at the end of this, remember to have your phones ready. You can click on the QR code to get more information. And Roy, that is a tough question right there for anybody, but I would imagine especially so for people talking Social Security.
It is, because with the Social Security Administration, one of the things they look at is kind of the length of that treatment relationship and how well your doctor would know you. Also the number of times that you've seen the doctor, right? You could have a doctor say he's totally and completely disabled, saw you one time when you were at your worst, and that opinion won't have a lot of bearing.
Not a lot of record of it.
Right. Where, you know, if you've seen the guy 15, 20 times and he says it, it's a much more informed opinion. So we have to be careful when we go to switch doctors, because it does have a direct impact on your case.
All right, there it is, all right?
Yeah.
The musts that are involved in this.
Well, that's right. When we talk about your treating doctor, really any examining doctor that you've seen too, you know, obviously their records need to support your claim, or else you're going to end up with a denial.
Right.
They need to be consistent. And when I say this, they need to be internally consistent. So the beginning of the note and the end of the note need to read essentially the same.
Okay.
We can't have a situation where they deny back pain and they were there to see back pain. And I see that more often than you think in the medical records. They'll deny numbness, but then they'll be treated with gabapentin for numbness. And sometimes the records are just not very...
supporting itself then, really.
That's right.
Okay.
And then, of course, you want specialized feedback from the doctor, too, right? You want as good of records as you can get. You want very specific findings. You want to make sure that they note that numbness, the tingling, the radiating pain, etc., and not just a general back pain, because we don't know as a secondhand reader what back pain really truly means.
Well, it probably would mean something different between us. So
That's right.
You can't have an objective kind of thing going there.
Well, and on the general sense, you know, if I'm advocating for your case, back pain means something different to me than if I'm on the other side at an agency that denies 2/3 of initial applications.
There it is. Okay.
So when you should consider switching doctors? Well, when your doctor's not supportive. And if you go in and tell your doctor, look, I'm having a hard time in the workforce, I'm thinking about filing disability, and the doctor says, well, you may need to look for a different opinion.
Okay. All right.
For sure. When they don't document your concerns thoroughly, and a lot of times this kind of parallels with the next one about rushing through examinations. I have seen records that just simply said client was a 58-year-old African-American female, and that was the entire note. Nothing about her condition,
in other words,
why she
I
was
could
there.
have done.
Well, exactly. But you know, if it's not thoroughly
Yeah.
detailing the things you're complaining about, then the secondhand reader can't see those in the medical records.
True. And I know this is, personally, this is something my doctor sits, talks, he takes his time.
Right.
And that's what you want.
Sure. And then the last thing here is, you know, if they only focus on the one condition that they treat, and a lot of times I'll see this kind of in reverse too, where you'll have people that go to their primary care doctor for their anxiety and their depression, and there's not a specialist. And on the surface, we kind of look at that and we say, well, how bad is it if you're not escalating your care to somebody who specializes in those things?
I see. Okay. All right.
So when it's time to make the change is the big question. Well, when your condition no longer matches your doctor's expertise, it's time to look for either a supplement to your care team, a new doctor, or you need to change specialties.
So that would be like if I had something wrong with my knees, maybe go to an orthopedic surgeon, that kind of thing.
Exactly.
Okay.
Exactly.
All right.
The communication is poor. You know, I've been to doctors myself personally. It was hard to get anything out of my doctor. I've had doctors in the past that would just simply say, will it work? I don't know. We can try it. Well, that doesn't really help me a whole lot when we have that type of approach. If you feel like the doctor's just dismissing your complaints, if they're glazing over them, they're hurrying through them, if you don't feel like you're really getting that traction, then it may be time to look for a different doctor.
Okay.
And then the last thing is as early as possible. When you start to see red flags, because you want to have that time to build a new rapport with a new doctor, to get that experience so those records have more meaning.
Of course, which goes back to some of the things you said at the beginning.
Right.
You've got to have a timeline going, so to speak. All right. Free consultation, same-day appointments. There's the QR code right there, the phone number. There's your disabilityrep.com.
And one thing,
Go.
882-1800 is where we've directed folks in the past, but this is direct to my desk, guys. The 812-6698, that number will ring at my desk. No receptionist, no paralegals, that's me. And in today's world, it's really hard to get a professional to throw their direct line out there and say, hey, call me here, but call me here.
Yeah.
I want to be your disability rep.
You stand by what you do.
I do indeed.
Absolutely. Give Roy a call. Back to you guys.
Thank you, Tom. You know, people might want to dig a little deeper into that, and he's a perfect person to call.
Exactly,
To
a
get more
great
information.
resource at the Resource Center.
There you go.